Good afternoon, everyone, and thank you for joining us to our home hemodialysis training webinar. I would like to introduce our subject matter expert. His name is Brad Hewitt. He's a home hemodialysis clinical educator with DaVita Healthcare Partners in Portland, Oregon. He trains new patients and then works as a care coordinator to follow their transition to independent home dialysis. Prior to working in dialysis, Brad was with a renal med-surg and transplant unit in Kansas City, Missouri. Decided to move to the West Coast in Portland in 2012. Enjoyed the outdoor recreation in the Pacific Northwest. I am sure he also doesn't mind getting away from the winters in Missouri. Following the completion of his Master's of Science in Nursing from Research College of Nursing in Kansas City, Brad has also been a clinical adjunct faculty with the University of Portland School of Nursing. And with that, I'll turn it over to you, Brad. One last warning, though. Please mute your phone, *6 if you do not have a mute button. Feel free to ask questions through the chat function. I do have that up, and I will let Brad know of any chats that come across. And I'm sure Brad will also give opportunity for questions maybe during his talk or at the end. So you can also unmute yourself then and talk. Everyone will receive 1 CE credit for being on this call today if you're a nurse tech or dietitian. And there will be instructions later on how to receive the CE credit for the live event. And also if you're listening to this as a recorded webinar. With that, Brad, it's all yours.
Thanks, Barb. And everyone, I think I would request, feel free during, as questions pop up, to message Barb, but if we could kind of keep those towards the end, maybe just so we don't detract. I'm sure everyone will kind of have some of the questions. Maybe towards the end we can address them as a group, if that's okay. And feel free as they come to mind. If you see some, shoot them to Barb, and maybe we can kind of just keep track. Is that okay, Barb? Would that be okay, Barb, if we do that?
Absolutely, Brad.
All right, thank you very much. And I can adjust my time if needed, Barb, to be done at 2, or we can, I'll take about the 45 minutes. So let me go ahead and get started here. All right, thank you, everyone, for your time today. I'm happy to provide more information. I hope this raises some more questions and just helps explain a little bit about what home hemodialysis is, which is something a lot of in-center folks may have heard about and not experienced a lot. So generally, and I'm also going to follow the guide that you will get. I pretty much wrote the chapter you'll be getting, and so stick with that so that when you download or if you get the toolkit chapter, it'll very much mirror a lot of my comments here. So feel free to take notes if you'd like, but there will be a lot more information in there as well besides the PowerPoint. So hopefully that should be useful for you. So generally, with a description of home hemodialysis, that I would say, for me, and again, I want to preface this as a lot of my experiences. I'll reference a few studies, but a lot of this is my personal experience as well. So if you run across some home hemo nurses with somewhat different experience, feel free, and that may also vary between companies as well. So I just wanted to throw that out there, that sometimes there's different versions to some of these descriptions. So patients have access to a fistula, graft, or a catheter in their home environment. That's what happens with home hemodialysis. This happens multiple times weekly, almost exclusively with the assistance of one other person. So usually patients will have to have a care partner. And then they conduct their treatments, and are actually very similar to the in-center hemodialysis treatments. It's the same process modified for the home environment. The machines used are 2 different varieties. We have the next stage cycler, and then we have a Presidius 2008K at-home machine as well, and they do make one for home use. Patients are then followed by a nurse after they go home. They register a dietitian and a licensed social worker on a regular basis, in addition to seeing a nephrologist at least monthly in a clinic when they come back in. And these folks make up their interdisciplinary team that sees them. The next stage, System 1 cycler, we'll talk more about shortly, is currently the most common as well. And that's actually used for 90% of the home hemodialysis market, so it's the vast majority of the patients we see. For this reason, most of the information you see provided today will be geared toward the next stage machine, because that's kind of what I deal with primarily, and that you'll hear about much more often with home hemodialysis. So again, in talking about that particular machine, patients treat with that 5 to 6 times weekly. Their dialysis rate is actually made at home, so again, these machines weigh approximately, and we'll talk more about this later, 70 pounds. They're designed for a simplified home patient operation, and they can actually be used with pre-mixed dialysate bags. So the fluid is pre-mixed, and all the patient does is hook up to that dialysate that's made, and it's already pre-made for them. The patients treat on average 5 to 6 times a week, as I said, and this is actually called more frequent dialysis within EMS terminology. Or it can be called short daily hemodialysis. Even though they aren't doing it every day of the week, it can still be called that. In some places, that's the way it's referred to. When treating at home, the patients make their dialysate rather than use the pre-mixed at home. They will make that dialysate by filtering their tap water, and then they combine it with the dialysate concentrate before treating. Let's see, and then we talk a little bit more about the dialysis flow rate here. The dialysate flow rate is slower than the Fresenius machine for the next stage cycler, and that has several benefits and has several challenges. The slower rate does mean fewer side effects to the patient, and a quicker recovery time post-hemodialysis than you'll see, because it's just gentler dialysis on the body. It really is. It's not typically used for patients that have a dry weight over 150 kilograms. Again, because of the dialysate flow rate being lower to get the volume of fluid through, and it's a limited volume, whereas you're hooked up on a Fresenius machine to the unit supply of dialysate. It's fixed on these machines, and so we can adjust that to an extent that that's fixed when they start the treatment. They can't start the treatment and then add more dialysate volume. So that's set, and as part of it, we can dial later to see that. Sorry about that. It was actually a pretty good video, so sorry about that. Hopefully everyone just turned the volume down and watched it, so sorry. Okay, well, onward. Yeah, it must have been a feedback loop, the only thing I can figure, and I don't know why. I didn't hear it here, but sorry about that. Okay, so let's get on here. The Fresenius 2008 machine we'll talk about briefly. Has the same operating parameters as the in-center machine. So it really looks very similar. It does require a portable RO machine at the patient's home. So it's another piece of equipment besides just the dialysis machine itself. It does 3 times weekly treatments, again, very similar to the in-center. Machine requires a minimum water pressure, so the patient may actually have to do some modifications to their home plumbing for discharge and water input as well. And this is, of course, more complex and has an extra piece of equipment as well. So you'll find sometimes it can be a little longer learning curve with it. Again, the next stage machine was designed for home patients. And so you can see it was a simple, small machine, the white machine in the video. That's 100% of the cycler in there. The tubing was all set up in there. So it's very small, portable, compact, and pretty simple. Versus a normal Fresenius machine, again, which at home looks just like the in-center almost, except it has a video screen. Okay, so that's the 2 machines. You saw the setup, and if you have questions about the next stage machine, and I apologize for the video, we can address those afterwards as well. So first of all, let's talk more about the benefits of home hemodialysis. Why should someone do that? Basically, one of the first things, and I've got them listed here, for most patients who treat 5 to 6 times weekly on home hemodialysis, again with next stage, they can remove this fluid and toxin buildup almost on a daily basis. So those patients have reported to us quite often they feel better after a relatively short period of time, sometimes even just a week of those treatments or 2 weeks. They're noticing more energy. I don't feel so wiped out. I don't feel, just like I need to go take a rest after I'm done. It's not uncommon to have patients say they're sleeping better and that they feel closer to the way they did before they left. They started having some end-stage renal disease. I've got patients who go back out and start gardening. Again, not 100% of the patients, but it is something you see more often than not with them. You may find often that diets can be liberalized somewhat, and patients can have more fluids. With more frequent dialysis, there's a possibility that they're going to be less restrictive. Obviously, with 3 times per week treatments from normal in-center, you have to watch your intake on those off days because you're not going to be removing that. With the home hemodialysis, often your off days are maybe 1 or 2 a week, and so you're taking that fluid off more often. So this is going to allow a patient to eat larger amounts of certain foods, such as those with higher potassium, again, because you're cleaning that potassium. It's not unusual if we have a patient on a 2K potassium bath in-center, that when they go home, they're on a 1K. So we give them less there, or vice so it's just usually a lower level that we have to give them because they're going to be able to eat that more in their diet since they're dialyzing it more often. Again, we talked about this somewhat, and post-dialysis fatigue will be usually less. I do note one study that does show over a 12-month period of time, they tracked an 87% decrease in recovery time from patients after therapy that improved as time went along once they switched to the Next Stage machine. And, full disclosure, this is a study that Next Stage references a lot. They also state on their website that they see a 1-hour clinical recovery period versus a 9-hour for in-center therapy. Sometimes they even reference a shorter recovery period. Again, that kind of varies by patients. Better match of dialysis to a personal schedule. Patients that are prescribed a set number of days for dialysis by their physician, but some patients prefer morning dialysis, others prefer later in the day. So the treatment doesn't always have to be at the same time of each day as well. So a person can treat in the morning one day and in the afternoon the following day. Additionally, some patients do not have to treat on the same days each week so long as they treat the prescribed number of times and then don't take excess period of time off without dialysis. So, for example, we say try not to take more than 2 days in a row, and we even encourage them in the initial to just take their off days every other day. So maybe dialyze for 2 days, 3 days, take a day off, then dialyze 2 or 3 more, then the day off, kind of do that. It's the best schedule, but if they need to take 2 in a row, they can, and so it's not a problem, and they can vary that if they need to. This offers patients more control over their dialysis treatments. So patients, because of the setting their schedule for dialysis, patients are responsible for performing and completing the treatment. For many patients, they like the feeling that this gives them more control, rather than having to conform to a schedule set by the center and kind of follow those rules. It also can kind of be a point of pride for some people that they're able to do that and maintain their own treatments. And again, this is an evaluation process we'll talk about later with barriers that we think about when we consider potential patients. So that patient has to be able to exercise that control as well. You may find that patients have reduced incidence of depression. There is actually a study that Next Stage references and some others that are out there that you'll definitely have benefits from. Again, you're getting more energy, you're feeling more freedom, maybe more control. You're in your home environment more when you're in your dialysis or conducting it, and that can often lead to a more improved state of mental status. And additionally, you're also, like everything else, removing more toxins. So again, along with filtering, potassium and taking the fluids out, you are keeping the creatinine lower and keeping those levels lower because you're doing it more often. So you may find that has an added benefit as well towards just improving mental status and decreasing depression. We mentioned how portable the dialysis is. This gives patients a bigger ability to travel with the system. Existing in-center patients can travel so long as they treat in-center. I have some patients who do that when they go on vacation. I have some that prefer to take their cycler with them. They, again, don't want to have to worry about a schedule, traveling to a site. They can dialyze in their hotel room, those sort of things. So since Next Stage cycler can be transported in a wheeled cloth bag, which is very similar to a suitcase, or it can be placed in a metal shipping container, which can be shipped on an airplane for travel. And the patient takes with them any bandages, tape, fistula needles that they would need. Specialized supplies such as the pre-mixed dialysate I had mentioned earlier that is offered by the company, and then other cycler items can actually be shipped anywhere in the continental United States by Next Stage. So we do a travel prescription for the patient. Next Stage, the company ships that directly to wherever we want them to. If they're going on a cruise, they ship it to the cruise port, and it gets loaded onto the ship and brought to their room. If they're going to Disney World, let a patient go there. It goes there. We just have to get that information set up in advance before the patient goes, and those supplies are there, so they don't have a lot to transport with them personally. Patients have taken their cycle with them camping, rafting on cruise ships. I kind of mentioned that as well, and then hotels, any other place like that as well. And it's very portable. The only requirements for that is just a clean area to perform your treatments. You do need a power source, which, again, with camping and things like that, can be a generator. I have patients who use that. And then a place to drain the effluent. So that can be a common plumbing, drain, shower, or even a toilet. So that's all they really need from it. You'll find that patients have, as we all would understand, if you're in your home environment, the majority of the time, it's just often a more common place to spend your time, and especially for dialyzing. So many patients just say they vastly prefer sitting in their favorite chair in the living room with their spouse or family around, or pets, while they're dialyzing. With us, our only restriction is that the pets can't be in the room when they're cannulating or when they're taking off from treatment. But beyond that, patients can be in there, and it's not uncommon to have them sitting on patients' laps at home. And as long as their access is secured and it's not, the animal's not bothering the lines or doing anything, it's perfectly fine. And again, more comfortable for them. So patients can watch the movies, favorite TV show. It just feels more normal to them in that sort of environment. You may find some patients have reduced transportation challenges with the home environment. And again, this isn't meant to substitute for someone who has a unstable home life that makes it difficult for them to make it to treatments and have other issues, which would bear on their ability to be a good home patient. But for some patients that drive long distances to the dialysis center, especially if they have early chair times, they're getting up at 4 in the morning, things like that, they don't have to start doing that anymore. So the convenience of not having to drive in rain, snow, ice, things like that, the cost of gas, their time, and for patients who use public transportation or even private transportation service that sometimes is inconsistent, that's something that home dialysis obviously, kind of takes aware of, that you don't have to worry about it from there. You may find that some patients reduce their medications. Again, going back to more frequent removal of fluids, we see it's pretty common for patients to reduce their blood pressure medications. Some patients completely eliminate them because you just don't have that fluid volume build up. And that also, and I'll talk about later, just in my personal experience with some patients, is a big reason for some patients that can't control their fluid volumes on in-center therapy do a much better job with this particular next-stage therapy because of that removal. And does, again, help with blood pressure and things like that. You may see, and this is unsubstantiated, but we do have, at least in my facility, 2 patients specifically, who stated that they had headaches very commonly, if not almost all the time, on in-center hemodialysis, and when we switched them to the next-stage machine, those went away. So again, not aware of that being studied anywhere, anything that's going on with it. Again, it may be due to the more gentle removal, slower dialysate flow rate, easier on the body, something like that. But it appears to at least be something for some people that is a benefit. Let's talk a little bit about a care partner, patient and care partner. As I said, those folks have to be willing and motivated. It can be challenging learning any new process at the beginning, and everyone comes in, with a higher stress level. We really work hard to encourage them and let them know there's a lot of support. So they will be taught the machine setup, the mechanics of the machine, troubleshooting, cannulation. Some of those things, of course, can be difficult, but they're all just processes, and we have to work with different ways to teach them to do it. But most patients are very much there. Home dialysis is a great mode of therapy for those who do their best in the home environment and desire the independence from a daily routine. So, again, letting the patients know what is coming is super important. They will be there for 5 days, 3 to 5 weeks, 5 days weekly, 3 to 5 weeks or longer. And the training time, since the patient treats, and most patients from the day one, they're actually training on training. So they walk in on the first day and we're hooking up the machine and doing the dialysis. So on top of that, we're also doing the training for setup and takedown and just what's going on when they're running as well. So I can add to the time. So most of the training days can be 5 to 6 hours, sometimes longer, initially in the beginning. And that's long days for anybody, especially when they're stressed, learning a new topic. So it's doable, it works out, but it is something to just let folks know in advance. So you need folks who really want to do it and are motivated to that, and we encourage them for that. Process can be tired and frustrating, but again, with patience and repetition, which once we teach them, that's really what we're focusing on, we found the great majority of patients and care partners can definitely be successful. We do use written, verbal, video, and hands-on techniques. We try to find what's best for the patient and what they use. We focus on that most often if we can. And then along with that, they will have a competency test they pass, and they can work on them together. You know, they work together when they're at home. We have them work on them together in class when they're doing that as well. And then practical demonstrations show us how you would do this, and then we observe technique and just repetition. So it works pretty well. Other things you would want, I'd say perhaps the most important skill for the patient and the care partner is going to be the ability to problem solve. You know, they're learning somewhat technical and repetitive skills such as cannulation, let's say, priming the machine. So again, we use written, verbal, and visual aids for these to practice. The home therapy nurse is there with them. The physician can be involved on how things are going and making sure they're safe to go home. So we do provide ordered instructions to the patients for all procedures and troubleshooting, so they always have a written reference to go back to from there as well. We do have 24/7 support from the manufacturer. Next Stage has a phone number they can call anytime they need to. And then I believe all clinics have an on-call nurse as well, so we're on call after